we have a lot of turnover due to the war in Syria. So not every SIA is operated by the same people. So every time you're faced with new people. So they were very motivated. I don't think we had any issues with motivating them, but the issues we faced is skills. These people are coming from so many different backgrounds, and basically you had to work with whoever you could find and would be willing to do this type of work. So you can work with lawyers or finance people, people who have never touched the health sector. So I think this was a hindering factor, because you don't talk to people at the same level. Everyone is at a different wavelengths when it comes to communication skills. So we've done a lot of basic training in terms of what is social mobilization, why do we need social mobilization, how can they convincing skills, how can they talk to people, interpersonal communication skills. And currently we're working on developing a training of trainers, where we actually are going to equip some people who are more resident, who are not interested in moving, so that they serve as trainers for us internally, and that we don't have to train every single group again and again.
When you keep the same close supervisor or the same health workers in the same area from the same and originally they are from this area, they know exactly the houses where to go, where to start, what the direction according to a map. And they themselves, the teams, they were drawing this map that they can know. Of course, this is not that easy task, but with many rounds was conducted in Yemen, the health workers and the team leaders, the close supervisor, we call them the close supervisor. For every 4 or 5 mobile team, we have one close supervisor. They were very much along with the community, and then it's easy even for the community to accept to be vaccinated, for the health workers to enter their houses and then to vaccinate their children.
For example, you take the example of Pakistan, where the frontline workers were shot dead. That is and the police forces as well. You know, the police forces were provided by the government to protect the frontline workers, but the frontline workers were killed and the police were killed. Then it's a different situation where you will have to remotivate everyone. I keep saying that there is no country in the world which has dedicated people as Pakistan. People died for this cause. It's not. You cannot have more commitment than that.
We've also seen a huge shift in the monitoring of the campaigns. We've seen people saying this, we've heard about the campaign before the actual campaign. This showed really the beauty and the importance of social mobilization, so that people arrive to the house, the family had already heard that there's an SIA, they know that the dates for it, they know why is it important.